It is my great pleasure to introduce today's keynote speaker, Emily Ottman, a dedicated advocate for women in STEM and an inspiring leader in the field of oncology genetics. Emily's journey began right here at MTSU, where she graduated in 2021 with a bachelor's degree in biology, concentration in genetics and biotechnology, and earning a minor in chemistry and global studies. She later went on to obtain a master's degree in genetic counseling from the University of Alabama at Birmingham, furthering solidifying her expertise and her passion for healthcare. Currently, Emily serves as a certified genetic counselor at the Inova SCAR Cancer Institute in Northern Virginia, where she empowers patients with crucial information about their genetic health, specializing in oncology genetics. Her work includes guiding families through complex landscapes of hereditary cancer testing and providing compassionate care to those navigating challenging diagnoses. What makes Emily's story truly special is her long-standing connection with the Tennessee Girls in STEM Conference, from attending as a middle and high school student middle and high school student, to returning as a group leader and student coordinator during her time at MTSU. Emily has been a beacon of support for young women aspiring to careers in science. Today she returns to TGIS to share her expertise, passion, dedication to mentoring the next generation of female scientists. Please join me in welcoming Emily Ottman, a trailblazer in genetic counseling and a role model for women in STEM. Big round of applause.
All right, guys. Thank you so much for that introduction, Fabian. So, like she said, my name is Emily. I'm a genetic counselor, and I'm so excited to be here talking to you guys about genetic counseling. This is a really exciting field. I know I'm a little bit biased, but it is constantly evolving. We combine science, human genetics, and compassion for people to do our jobs every day. And the world of genetics is constantly changing. We are learning new information every single day. And so it is something that always keeps you on your toes, and we are constantly innovating. So I know I already had a little bit of an introduction, but I want to go through and show you guys some pictures, a little bit more about me. So I currently live in Washington, D.C. with my fiance, Kobe. We moved here in 2023, and I work at the Inova SCAR Cancer Institute. I came to Washington, D.C. after graduating with my master's degree from the University of Alabama at Birmingham. And so here's a picture of me and all of my classmates. There were only 8 of us on graduation day. And then here's a picture of me from my graduation at MTSU in 2021. And like she mentioned in my introduction, I was really involved in TGIS as a college student, and before that as a middle school and a high schooler. And so here are some pictures from my time as group leaders in different year, having fun with some liquid nitrogen there. So I want to start off with a show of hands. So if you have ever heard of genetic counseling, or if you've ever heard of a genetic counselor, can you raise your hand for me? Okay, honestly, that is more than I was expecting to see, I will be honest. For those of you who did not raise your hand, do not worry. I'm going to go through and share a lot of information about what it is that genetic counselors do, and even show you guys some case examples where you get to be in our shoes and pretend to be a genetic counselor yourself. So I want to start with a little bit of an overview of what it is that genetic counselors do and where you can find us. So we are an important part of the healthcare team. As our title suggests, we are extensively trained in medical genetics and psychosocial counseling. So in order to be a genetic counselor, you do have to have a Master's of Science degree in genetic counseling. This is what we call a terminal degree for genetic counselors, meaning after you get that master's degree, there is no other required schooling to become a genetic counselor. That does not mean that genetic counselors don't go on to get additional degrees. There are plenty of genetic counselors out there who have PhDs, other master's degrees, or even MDs. We work with a lot of other providers in the clinic. So genetic counselors do not work alone. It is definitely a collaborative effort. We work with physicians, we work with surgeons, we work with nurses and dietitians, ultrasound technicians and radiologists and more. In fact, you can find genetic counselors in pretty much any area of medicine, and we're going to be working with everybody involved in that sector of care. There are certain specialties that you'll find more genetic counselors than others, and so some of the common specialties for genetics providers are in cancer or oncology, in prenatal genetics, pediatric and adult genetics, cardiology, cardiology are some of kind of the traditional areas, but we are definitely entering into an era of personalized medicine where we're using a person's DNA to help make decisions for their medical care. And anywhere you're doing genetic testing and you're interpreting those results, you're gonna have genetic counselors working with you. And so you can pretty much find a genetic counselor working in any specialty of medicine. I want to give you guys the official definition of genetic counseling because for a very long time, our profession is relatively new. The first genetic counseling training program didn't start until the 60s. And so for a while, we kind of had this nebulous idea of what it is that genetic counseling was, but we didn't have an official written summary exactly. And so in 2006, we published the official definition of genetic counseling after a lot of research and talking to different GCs. And I have it here. So genetic counseling is the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. And this combines three different main things. The first is interpretation of family and medical histories to assess the likelihood of a disease happening or coming back. And then educating patients about inheritance of these genetic conditions, how we test for them, how we manage them, resources and research about that particular condition. And then finally, counseling patients to promote informed decision-making and choices and adaptation to that risk or condition. As you can imagine, after kind of going through what it is genetic counseling, there are several skills that you need as a GC to be good at your job. The first of which, and probably the most important, is being an expert in genetics. We spend a lot of time researching genetics and in the classroom and reading those textbooks to become that content expert in genetics. And so that's the most important piece. But you also need to have those counseling skills where you are able to talk to people and communicate and teach them about this complex topic and explore how they feel about it. How do their family members feel about this information? And be able to counsel them through this process. You also need to be able to teach information, which is related. We, in every genetic counseling appointment, are basically giving people a mini genetics lesson. We're talking about complex things that most people either haven't learned about at all or had a class on in high school or in college, but we have to be able to condense this complex information down into manageable information that people can understand so that they can make choices for their personal healthcare decision making. It's also important as a genetic counselor to have a continuous desire to learn, which is something I think all of you who are here on a Saturday morning probably share, this desire to learn more about your field. As genetic counselors, your education does not end the day that you graduate with that master's degree. Like I said at the very beginning of my talk, information is changing all the time. Even in the year that I have been practicing as a genetic counselor, things have changed from what I learned in grad school because new information and data has come out to change what we do and what we know about these genetic conditions. It's also important to have research skills as a genetic counselor, even if you are not actively doing research every day yourself. In genetic counseling school, you do have research projects that you do, but it's important to understand the process of research so that you can understand how we interpret the results and the finding of that research and implement it in clinical care. As a student here at MTSU, I was afforded the opportunity to do research as an undergraduate and be involved in several different projects, and I was incredibly lucky to be able to do so here at MTSU because that is not something that is afforded to every undergraduate student. Finally, it's also important as a genetic counselor to have a knowledge of the healthcare system itself. It is a complicated machine. There are a lot of different moving parts. There's a lot of different providers, and it is not something that is necessarily intuitive. And so you need to have an understanding of how that healthcare system works so that you can navigate it as a provider, but also so that you can help your patients figure it out themselves. So we've kind of talked about the most traditional genetic counseling workspace, which is this clinical setting, usually in a hospital or another clinic room where you're meeting one-on-one with a patient and their family members. But that is certainly not the only place that genetic counselors are working or are employed. Anywhere outside of those traditional clinical settings, we refer to largely as industry positions. And this is a catch-all term that could mean a lot of different things. So it could mean genetic counselors working in educational spaces, training other future genetic counselors. Or it could be genetic counselors working in genetic laboratories, the companies that are doing this testing and working on that side of things rather than on the side directly interacting with patients. Or this could be genetic counselors doing that research, doing research every day on the field of genetic counseling or in genetics in general for published information about our field. Or it could be people working in private companies and businesses in marketing or sales or pharmaceutical roles where they're applying that knowledge that they learn as a genetic counselor in their training or clinical practice, and they're bringing it to other fields and kind of benefiting it there. I also like to give a general snapshot of the field of genetic counseling, because this is something that people are often interested in when you're thinking about a career, is what are we paid? And so I got this information from the Professional Status Survey, which is a big survey that was sent to all genetic counselors to get an understanding of the average compensation and kind of demographics of the profession. And so in 2023, the average salary for a genetic counselor was just over $100,000, and this included genetic counselors of all experience levels working in all different fields and types of jobs. For clinical genetic counselors working in those traditional spaces, that average was about $87,000. For industry genetic counselors working in these private companies, primarily, that was higher at $125,000. And the average starting salary for graduates in their first job after graduating with their master's degree was about $80,000. So now we have defined genetic counseling. We've kind of done a brief overview of what it is that we do and where you can find GCs, but I want to make sure I give you some explanation on how, if this is something that even is interesting to you, how you could become a genetic counselor yourself. And the most important piece of that is definitely education. And I know all of you guys are definitely a long ways off from graduating from college and thinking about getting a master's degree. The first step is definitely succeeding in middle school and high school, but after that, you do need a bachelor's degree. It's important to know that if genetic counseling is your ultimate goal, there's no hard and fast rule of what kind of major you need in undergrad. There are some that you'll find more commonly, like biology or genetics, biochemistry, psychology, or people on that pre-med track, but ultimately you can have whatever major is interesting to you as long as you meet some of those prerequisite course requirements that most programs require for admission. And those kind of vary program by program, but most of them do require courses in biology, genetics, chemistry, and statistics. After you get that first degree, you need to go in and get the second one. So in order to be a genetic counselor, like we already know, you do need to get a master's degree. All these are about 2-year programs that combine a combination of classroom and coursework and hands-on clinical training, where you're working directly with those patients in a clinical setting under the supervision of a licensed genetic counselor and applying that skills that you learned in the classroom. And all programs do also require a capstone or a thesis project where you pick a research question in your first year, and then you spend the entirety of your second year conducting that research and writing and presenting your findings. There are just under 60 programs that offer a genetic counseling master's degree in the United States, and this number is going to continue growing. There are a couple other programs that are new and are applying for their accreditation, but all the programs are quite small. So you saw a picture from my graduation, there were only 8 students, and that is pretty average. So genetic counseling programs only have between 6 and 10 people on average, so those class sizes are small, and it's a pretty competitive process to get in. After you get that master's degree, you need to become a board-certified genetic counselor. That's kind of the final main hurdle to cross in order to be a fully functioning genetic counselor. This is a comprehensive exam that you take after graduating with your master's degree that covers topics from everything that you've learned in graduate school. It's a 200-question test, and it's pretty comprehensive, and it's a little bit intimidating, but once you pass that, you become a certified genetic counselor, and you're then able to go on and apply for licensure if your state has that requirement, and then work with patients and be a fully fledged genetic counselor. I mentioned that it's a pretty competitive process to get into these programs. There's not a lot, and all of them are pretty small. And so I always like to have some helpful tips on how to be a competitive applicant. It's important to know that if you want to be a genetic counselor, do not feel like you have to hit every single one of these. Programs look at you as a person and everything that you can bring to the table, but these are some helpful tips. In order to be a genetic counseling applicant, I do think that something that is required is having some sort of knowledge about the profession of genetic counseling. Programs are looking for students who know what it is that a genetic counselor does and has a good grasp on how we work in the field of medicine. No one's expecting you to come in with the knowledge that you'll learn in graduate school, but everyone's looking to see that you have spent some time to talk to your genetic counselors or shadow them or just have a good understanding of what it is that we do and what kind of groups that we work with. Having advocacy or volunteer work is also something that is very helpful. When you are spending your time for a cause, that's something that is altruistic and good, but programs are also looking to see that you've spent some time with groups of people that we may interact with as a genetic counselor. So this can mean a lot of different things. I worked as a crisis counselor, for example, with a shelter here in town, but you could be working with adults or children with special needs. I had friends who worked as daycare teachers, and so there's a lot of different things that you could do for this advocacy or volunteer work to show that you've spent this time, you've learned these skills that are applicable to your practice as a genetic counselor. Having leadership experience is always something that's going to help as well, showing that you're good with communication and time management. Being up to date on any kind of interesting genetics news is also helpful, things that you can bring up in your application to show that you're just really interested and you're tuned into the world. Research experience in college is also something that can be very, very helpful. There are a lot of skills that you gain from being involved in research in undergrad, time management, attention to detail, understanding how to do scientific writing. Again, kind of understanding this process and what the results tell us is something that, especially since you need to have those skills as a genetic counselor, can help your application. And then if you're able to get a genetic counseling assistantship where you're working directly with genetic counselors and helping them in their clinical practice, that's something that is definitely very helpful because you can not get better hands-on experience than that. So now we have talked about what genetic counseling is, where do we work, and how do you become one if this is something that interests you. So now I want to kind of put you in the shoes of a genetic counselor and walk through a couple of case examples of different specialties to kind of walk you through how we do genetic counseling and some examples that you might encounter. So the first one is a pediatric case example, and you and the geneticist get a referral for a 13-year-old boy with tall stature. You see he's over 6 foot tall for a 13-year-old. That's quite unusual. You also note in his chart that he has scoliosis, which means he has an abnormal curvature of his spine, and he has myopia, or nearsightedness, and needs glasses to correct his vision. He was referred to you by his pediatrician for a genetics evaluation to see if there's anything going on that can kind of explain all of these symptoms that you're seeing in him. So you bring the patient and his parents into clinic, and the geneticist starts off with the physical exam. And so during the physical exam by the geneticist, you discover that this patient has quite long fingers, and he has pretty flat feet. You notice that he has braces, and he needed a palate expander for his braces. He also has some stretch marks on the back of on his lower back and on his thighs on the back of his legs. And he has a slightly abnormally shaped chest. This is called pectus excavatum, where he has a slight concave, his chest kind of dips in a little bit. But he does really well in school, straight A's. There's no concerns for any learning disabilities or intellectual disabilities. And so after the geneticist has done their physical exam, you come in and you take a family history. And so you draw a pedigree for this patient. And I want to kind of orient you to what it is that a pedigree does for us. And so this is a tool that genetic counselors use to take a lot of family history information and distill it into a picture that we can basically look at and see very quickly information about this patient and their family. So squares are men and circles are women, and our patient is denoted by this little arrow down here at the bottom. And so you see that this is our patient. He's 13 years old, tall stature, scoliosis, and myopia. He has an older sister who's 16 years old. She's not particularly tall, doesn't have any issues with her vision. You ask about patient's dad's side of the family. Dad's 5'11", no known health conditions. Grandparents are healthy. Grandma has type 1 diabetes, but there's nothing else really going on. Mom is there in the room, and when the geneticist is doing his physical exam, Mom also mentions that she needs glasses to correct her nearsightedness, and she also has flat feet. And she's also pretty tall. She's over 6 foot for a woman, which is a little bit unusual. She's an only child, and her dad is still living and has no known health conditions, but you notice that the patient's grandmother died of an aortic aneurysm, and she was also over 6 feet tall as a woman. An aortic aneurysm is something that is kind of a red flag to us when we're seeing this kind of constellation of findings in this patient and his family members. An aortic aneurysm is where the main blood vessel that takes blood from our heart and pumps it to the rest of our body becomes a bit stretched out, and it can cause a rupture or a tear in that blood vessel, and it can lead to a sudden death. And so we have gotten a lot of information from this patient and his family, and so the question is now, do we offer genetic testing for this patient? The answer is yes. So you and the geneticist are both suspicious of a connective tissue disorder called Marfan syndrome for this patient that kind of could explain all of the things that we're seeing in this patient and his family. So you go in, you order genetic testing for this patient, get a cheek swab from him, and about 3 weeks later, you get a genetic testing result back that shows that he has a pathogenic variant, which means a genetic mutation, in the FBN1 gene, which does confirm that he has Marfan syndrome. And so you call the patient and his parents to come back to clinic to do your follow-up, and there are main things that you want to immediately do for this patient. The first is we want to get him in to see a cardiologist. We want to get his heart evaluated because we know that there is an increased risk of heart conditions with people who have Marfan syndrome. Basically, this condition is where the connective tissues that kind of keep our body together, keep our blood vessels together, keep our muscles and our bones together, don't do as good of a job of keeping everything together. And so there is that increased risk of having the blood vessels in your heart stretch out and can cause that sudden death. And so we want him to get evaluated and followed for that immediately. We also want to make sure his eye doctor is aware of this diagnosis because there are even connective tissues in our eyes that keep our lens in the appropriate place so that we can see. People with Marfan syndrome have an increased risk of those connective tissues in their eyes stretching out and having a dislocation of their lens. And so we want him to be followed by his eye doctor closely for that. We also want to get family testing done. Based on the family history, we think that this probably is coming from his mom. We also know that 75% of people with Marfan syndrome have a parent who has this condition as well. And so we want to get her tested to confirm whether or not this came from mom, and so that she can get the appropriate doctor's referrals as well. Then finally, we want to provide education. What is Marfan syndrome? What does this mean for him now? What does it mean for him in the future? And get him involved in any support groups that are available locally or nationally so that he can have other people and connect with other people who have the same condition. Just be aware of kind of the lifelong implications of this and what we can do to help keep him and his relatives healthy. So that was an example of a pediatrics case. I now want to do a case example of an oncology or a cancer case. And so now you are a cancer genetic counselor, and you get a referral from an oncologist for a 30-year-old woman who was recently diagnosed with hormone-negative breast cancer. Her oncologist and her are trying to kind of figure out what her treatment plan is, and they want to get genetic testing to kind of help them make some of those decisions for her treatment. Before we jump in and I show you the pedigree for this patient, I want to go through and at least briefly explain kind of the main causes of cancer. It is important to know that most cancer cases are not due to genetic mutations. The vast majority of cancers, I'm talking more than 80% of cancers, are what we call sporadic or random. They occur due to chance or by environmental factors or a combination of both of those things. It's only about 5 to 10% of the time where we can do this type of testing and identify a genetic or hereditary cause for a personal and family history. Knowing that we're looking for such a small percentage, when we're looking at a patient's personal diagnosis of cancer and their family history, we're looking for a combination of kind of red flags that suggest to us, hey, maybe they are part of this small piece of the pie. And so you have the patient come in and you draw another pedigree, and you note that she's here, she's that 30-year-old with the arrow pointing to her with that breast cancer. She has 2 siblings that are healthy. Her mom's side of the family, there's no known history of cancer. But you see on her dad's side of the family that her dad unfortunately passed away quite young because of a very aggressive type of prostate cancer. And his mother died also in her mid-50s due to an ovarian cancer. And so we're seeing 3 different types of cancers, but in 3 different generations of this family. And so the question is, now that we know a little bit about this patient and her family, is do we offer genetic testing for her? And once again, the answer is yes. There are a couple of those red flags that jump out to you when you're looking at this patient's personal history and her family history. The first is which is she was diagnosed very young with breast cancer. Breast cancer is the most common type of cancer that women are at a chance of having in their lifetime. So that on itself isn't unusual, but it is unusual to be seeing it diagnosed in someone so young. We also know that her breast cancer was what we call a triple negative breast cancer or a hormone negative breast cancer. It didn't have any of the hormone receptors that we can see on her tumor. And that just is a more rare type of breast cancer because there's multiple different types of breast cancers that can happen. We know that there's a greater chance of it being due to a genetic mutation when we see a triple negative breast cancer. We are also seeing cancer in multiple generations of the family. Her dad, and her grandmother all had cancer, and her grandmother had a more rare type of cancer also. That ovarian cancer is much less common of a cancer than a prostate cancer or a breast cancer, and so that is a red flag also. In addition to that, all three of these cancers, although they're all totally separate cancers, we know that they can be related to each other in certain hereditary syndromes. And so as a clinician, you know all of this, and you know that you're suspicious of a condition called hereditary breast and ovarian cancer syndrome, because this could explain the patient's young diagnosis of breast cancer, her dad's prostate cancer, and her grandmother's ovarian cancer. So you go and you order testing for this patient, and a couple weeks later, this comes back in her report that shows she has a pathogenic mutation, which is a known harmful genetic change in the BRCA2 gene, which does confirm her diagnosis of hereditary breast and ovarian cancer syndrome. You tell this patient that this likely does explain her personal and family history of cancer. We know that there is an increased risk for women to develop breast cancer. Men who have a BRCA2 mutation are also at an increased risk of getting male breast cancer, prostate cancer. Women are at an increased risk of ovarian cancer, and everybody's at an increased risk of pancreatic cancer. And so when you go and talk to this patient about her results, you first kind of talk to her about what we can do for her current breast cancer treatment, but what we can do for her moving forward. Now that we know that she's at an above average risk of getting another type of cancer, we want to implement screening so that she can try to reduce the likelihood of another cancer happening and keep her as healthy as we can. So we have talked about a lot today. We've covered a lot of ground about genetic counseling and doing these case examples, and I want to close with this picture. So on this side is a picture of me from 2011 when I was 12 years old, extracting DNA from a strawberry at a children's museum in Maryland. And on the other side, that was me last year on my first day as a fully fledged genetic counselor. And so even though genetics or genetic counseling may not be something that interests you at all, I do want to encourage you to take this time in your lives to kind of learn what does interest you, find your passion, and do everything you can to go and make a positive change in the world for other people. So with that, I will see if anybody has any questions that I can answer for anyone.
Is there any risk for getting a genetic testing? Can't you just give it to anyone who asks for it?
That's a good question. So, the process of getting genetic testing itself is not something that's inherently dangerous. So, genetic testing is done either with a blood draw or with a cheek swab. And so, there's nothing dangerous about that. But there are certainly reasons why people would not want to do testing. So some people are interested in getting genetic testing to find if they have a predisposition to cancer or find if they're a carrier of certain conditions that their kids could be at risk for. But other people don't necessarily want to have that information. Some people say that knowing if they have a genetic mutation may cause them more anxiety than it would benefit them. And so that's why, although anybody should be able to have access to genetic testing if it's something that they want to know about themselves, I'm of the opinion that this is information everybody deserves to have if they're interested in it. But it is important to have the genetic counseling component so that people are aware of reasons why they would or would not want to do testing. It's also important to know that there could be insurance implications in genetic testing. There was a federal law that was passed in 2008 called GINA, which is the Genetic Information Non-Discrimination Act, that said that your health insurance company and your employer could not discriminate against you based on genetic testing results. But that doesn't include life insurance and long-term care and disability insurances. And so some people may want to hold off on testing until they have those things kind of taken care of, just because of the possibility of that happening. So there's a lot of kind of different reasons why people would or wouldn't do testing, I would say. But no real risks other than those things that we kind of talked about.
Has there ever been a scenario where the genetic test came back positive and you couldn't do anything about it?
That's a good question. I would say it depends on kind of what you mean about doing things about it, because this information, if someone has a mutation, it's something that they have had since the day that they were conceived in their mom's womb. And so it's nothing that we can change. We don't have the ability to change someone's DNA. And so we can't do anything about it in that regard. But sometimes, and oftentimes, there are things that we can do as a result of finding that mutation. Working in hereditary cancer specifically, whenever we find that someone has a higher than average risk of getting cancer, we can't know for certain whether someone will get cancer or not. Having a mutation doesn't mean that that will happen, but we can change how we screen people. And so maybe we can't always prevent a cancer from happening. Sometimes there are medications or surgeries that people can have to reduce the chance that a cancer will occur. But a lot of times we're just changing how we screen people and look for those cancers with the goal of, if we know someone's at an increased risk of it happening, we're looking for it and hopefully catching it when it's early and treatable.
Have you worked on more cases with cancer or just like syndromes in general?
Well, when we're training as genetic counselors, we train as generalists. So you work and you learn about all specialties of medicine. And so in my training as a student, I worked in pediatrics clinics and metabolic genetics clinics and adult clinics and cardiology clinics. And so I saw a lot of cases in those areas. But now that I'm working in cancer, I definitely see more patients in cancer because that's just the job that I'm in. But we have the ability to kind of change jobs because we train as generalists. We can move around. If you want to start in pediatrics, you can. And you can switch to cancer later, or you can work in neurology. And so.
So my mom had an aortic aneurysm. She had one on her ascending that she had to have emergency surgery on, and she still has one on her descending. Is that something that's genetic? And if so, is it like, where can I go to get?
Yeah, it's a good question. And, not having any information and not being your mom's provider, it's hard to say. I would say if it's something that you're concerned about, and if it's something that your mom is interested in getting evaluated, there are options for cardiology genetic testing to kind of talk to someone who can give you a more definite answer based on your mom's history and your family history.
So where could I go to do that
Yeah,
testing?
it's a good question. So there's actually a website called findageneticcounselor.org where you can put in your zip code and the specialty of genetic counselor that you're interested in seeing, and you can find local genetic counselors or genetic counselors that work virtually that can see you in Tennessee. But I know that Vanderbilt is probably your best place here in Middle Tennessee to get specialized cardiology testing.
I was wondering how much it costs on average to get genetic testing.
Ooh, well, it depends on what type of genetic testing you're getting done.
Say cancer.
So for hereditary cancer testing, if someone meets insurance criteria, so if they have some of those kind of red flags that we talked about, it's something that insurance companies usually will approve or pay for all or most of. Differences in insurance plans is really what it comes down to. So how much will your insurance company pay? How much is your deductible? Or what are you responsible for paying after your insurance or before your insurance? I know that most of the labs also have an option for a self-pay price, where if someone doesn't have insurance or doesn't want to use their insurance, they can just pay out of pocket. And so most of the labs have a self-pay price of around $250 for hereditary cancer testing, but the type of testing that you're doing will vary based on the indication, and also different types of genetic testing will cost a lot more or could cost less than that. Yeah.
Is there genetic testing for animals?
Actually, yes, there is. So there is some pretty popular genetic testing that you can do to find out kind of what breed your animal or your dog is. They even have pet genetic counselor jobs available for those companies. So if that's something that really floats your boat, you could be a pet genetic counselor.
So I have a question. What did you want to do before you figured out you wanted to do genetic counseling?
Yeah, that's a good question. And I think the answer was I didn't really know. I learned about genetic counseling when I was a kid because we worked with a genetic counselor briefly when I was pretty young. And so I've known about genetic counselors for a long, long time because I knew that they had a positive impact on me and my family. But I didn't really know that that was what I wanted to do for certain, probably until I was in college. I knew that I was really interested in science. actually my high school AP biology teacher is in the room, and she did a lot in kind of helping me discover, wow, I'm actually really good at biology, and I think I want to do this for a career. So, but yeah, I knew I wanted to be involved in science, and medicine was interesting, but I didn't really have the call or the calling to go to medical school. And so I kind of circled back to genetic counseling and realized this was kind of what my passion was, and kind of combined all of the main things I wanted to do.
So you said earlier that once you're conceived, you can't really change the genetics. But what about genetic counseling at like IVF level?
Yeah, and that's something that is really interesting, and that is kind of the way that we can change the story. So there are options for what we call pre-implantation genetic testing, or PGT for short. And when people are doing IVF, even if they have no known genetic condition in the family, we often do offer what is called PGTA, or pre-implantation genetic testing for aneuploidy, or chromosome number differences, where we're looking at the genetic complement of an embryo to see if there's any abnormalities or differences there. But if someone has a known identified genetic mutation in the family, we can also do specialized testing for that one condition. So for example, if someone has a BRCA1 mutation that they don't want to pass down to children, then they can do IVF PGT and select to use embryos that don't have that mutation. I'm never, and no genetic counselor is ever going to tell people that they can't have kids if they have a genetic mutation, because genetic mutations have been around since the dawn of humanity, and they will continue being here forever. But there are now options through reproductive technology innovations where we can help change the story for future generations.
Are there different treatments for different genders?
Yeah, and I think that also really depends on the condition. So in hereditary cancer, so where I work, for example, there are definitely different things that we do for people who are biologically male or biologically female, because there are different types of cancer risks for those people. People who have breasts are at that higher risk of getting breast cancer if they have one of those genetic mutations, and women don't have prostates, so we can't screen them for prostate cancer if they don't have that specific organ. And so what we do and what ages we start and how often we screen definitely does depend on someone's, biology. Yeah.
I want to apologize. We have time for one more question. Okay, here you go.
My mom, when I think last year, was diagnosed with pancreatitis. How would me and my brother and even future generations, how could that be something that could appear?
Yeah, it's a good question. And again, kind of giving specific medical advice is not something I'm really able to do, especially not having any real details about the family. But we do know that for certain conditions, if you have a relative with that condition, you may be at an increased risk of getting it yourself. And there are a lot of different things that could cause a person to get pancreatitis, so it's kind of hard to speak specifically about it. But we do know that, for example, there are some genetic mutations that can cause a family to be at an increased risk of getting pancreatitis, and that's something that we do have some genetic testing for. And so, for example, if it's something that if your mom has pancreatitis and she has other relatives with, maybe that's something that she does talk to a genetic counselor to see if she's a good fit and is able to consider genetic testing. So,
All right. Well, we're going to give our keynote speaker a hand clap. Appreciating her, Emily Upman, UTSU graduate.
Yeah.
Yay! We want to thank you for being our keynote speaker.
Thank you so much.
We enjoyed that. I was sitting there thinking, yeah, she is telling you guys the truth. The whole time I was over there shaking my head. But yeah, we want to thank you for taking the time out to do this.
Of course.
We appreciate this. I know a lot of girls, we had a ton of questions that were left unanswered. I'm so sorry.
And I'll hang around too if people are able to come up and ask me a quick question. I know that there's a schedule and people are heading to workshops, but I also have my email here. So if anybody has questions, you can also email me. Just note that there are 2 N's in my last name.
Awesome. Well, we got her a little gift.
Very much appreciated. Thank you guys so much. You want me to open it?
You want to open it? Go ahead.
Sure. my gosh. I got a very nice jacket here.
Oh, that's nice.
The Women in STEM Center.